Through client-centered treatment modalities, including solution-focused, brief therapy, and narrative therapy, Sean helps individuals rediscover themselves, not by the exclusion of, but within the context of their family and environment. If you don't understand that, it's okay. There's no quiz coming up. Now, during his free time, Sean, a judo taekwondo black belt, listens to music and plays basketball, and definitely also has a lot of fun with his wife and his children. So let's put our hands together for Sean joining us this evening. We thank God for bringing him. Before he takes the mic, of course, I'm going to read a passage of scripture. Sean, one thing I didn't know about you was that you were a judo taekwondo. I didn't know that part about you. All right, so I probably need to come and register now so that you can start training me as well. We're going to read a passage of scripture, then I'm going to turn it over to him to do his presentation. I'm reading from the book of Proverbs, chapter 1. I'll read the first 8 verses. Proverbs chapter 1. Let me just read the first 8 verses. The Bible says, the Proverbs of Solomon, the son of David, king of Israel, to know wisdom and instruction, to perceive the words of understanding, to receive the instructions of wisdom, justice, judgment, and equity, to give prudence to the simple, to the young man knowledge and expression. A wise man will hear and increase learning, and a man of understanding will attain wise counsel. I'll read verse 5 again. A wise man will hear and increase learning, and a man of understanding will attain wise counsel. To understand Proverbs and an enigma, the words of the wise and their riddles. The fear of the Lord is the beginning of knowledge, but fools despise wisdom and instruction. Really, what I want you to pay attention to is verse number 5, because really what the Lord is bringing us to do in this setting is to gain wisdom. A wise man, a wise woman, a wise boy, a wise girl will hear and increase knowledge. And a man of understanding will attain wise counsel or retain wise counsel. So it is my prayer today that as Sean shares, as we listen, as we write down questions and interact, that we will actually increase in knowledge. Like was said in the beginning by my daughter, if any of us is struggling with this, you see, this is a forum where you don't have to come out in the open to tell anybody, but it is to say that there's no shaming in this, that all of us had one struggle or the other in some way, and God can help all of us. So without any further ado, I want you to join me in welcoming my friend, Sean Kim, as he takes the lead in the discussion. Sean, you're welcome.
I'm sorry. I accidentally muted herself. I'll repeat myself. Thank you for this time to share some of humble knowledge that I have with congregation. Most of all, praise the Lord. And God's already begun to humble me through this process, because I actually have to admit I got some of the questions wrong, especially around the statistics. With that, I want to say that the focal point of this talk would be more of kind of a casual discussion around what I know. And of course, you guys could ask questions after. But if you feel that there's any questions or some things that you would like me to address during the process of my talk, you're welcome to let me know. As far as how that will go, I think Pastor Alex will be able to help us out. So let me just start with um, um, what is addiction. Um, so I think the best way to explain what addiction is first kind of delineate addiction from substance use disorders. So addiction is more of a broader term where it's pretty much describes anything that can enslave a person to a specific object or substance use, or it could be gambling, it could be. Now, I'm going to go into describing a little bit about the actual brain chemistry that's biology that's attached to that. But addiction is the broader term. So, but interestingly, most majority of them have the same effect in your neurochemistry. So whether I'm doing gambling or I'm addicted drugs, it kind of produces the same mechanism in the brain, the broader stroke. So I'm not going to details a lot today, because this is more so about having a broader understanding and actual practical applications to what we can do as a church and the community and family to help those that are struggling. So kind of coming back, and if I kind of gravitate, if I digress, Pastor, please make sure that you interrupt me at any point and kind of bring me back. So just to kind of go back to what addiction is. So that's addiction. Now, when you are struggling for a specific type of illicit drugs or a substance, then we will call it a substance use disorder. And again, some people are able to, for example, like alcohol, use it and moderate and have no issue. But and this goes back to one of the questions. Now, the deciding factor of whether how someone becomes addicted to a certain drugs or it really has to do with genetics and other things that I could potentially cover as we discuss it today. So, in short, addiction is this over attachment to a specific activity or substances that are initially there to produce some kind of pleasure, and that which later leads into dysfunction or disorder in life. Um, Now, that's just a general term. The most important part, though, as far as our discussion is concerned today, is how does it affect our youth? And how does it affect us today? Because with COVID, there's a couple of research that's already out there. One of the biggest thing is people that are struggling. I mean, obviously the use of drugs and alcohols and addictive behavior has gone up significantly. But more than anything, mental health wise, there's a lot of strain, just the generalized anxiety, depressive symptoms, and even the ones that normally would be otherwise healthy has been under a lot of stress. So one of the maladaptive coping mechanism that people develop under these circumstances is addiction. Or, like, and even if you had some sort of an anxiety disorder or something that you're normally struggling with that you're fine medicating, some stressors like this could make you go overboard, and then you kind of lose your regulation, leading to abusive or inappropriate use of your medicine. That's why in the recent years there's been spike in a lot of prescribed medication too. So the key point about this is that what's really important when it comes to addiction or substance use is not the content, it's not what drug are you using. A lot of stigma around it, especially if even where I work, there's this weird stigma between somebody who came to the treatment for alcohol versus somebody who's doing heroin. Then there's that shame, right? There's a layers of shame, and that goes more to the heroin. Was like, well, I use alcohol, but not that. You see, that's where we could, or the culture could really go wrong and mislead us. That certain drugs are dirtier than the other drugs, and that's not necessarily true. But kind of coming back to how does it affect our youth is, so I think the best place to start is that whenever you talk about addiction or drug, only thing that you have to remember chemistry wise or anything technical is dopamine. So what happens with dopamine is it's a chemical that's produced in our brain that makes you reinforce certain behavior. So when I eat sugar, then I feel good, the good tasting. So there is a chemistry in my brain called dopamine that's produced to remind me to repeat the behavior. Now, when we were back in the days when we didn't have a whole lot of stimulation or artificial um, chemicals or drugs or TVs and all these extra artificially stimulating things, our brain was in a good place. But as the technology develops, as there are more synthetic drugs that are there, like drugs are more potent, everything we do is a lot more stimulating. So, for example, let's take a youth today. Probably compared to us when we were children, their dopamine level is probably lower. Now, dopamine is important in many different things, but one of the biggest thing for dopamine is to keep a person motivated, which also involved in regulation of a lot of things. So what ended up happening with the kids is that it's called tolerance in substance use or addiction. The biggest issue is there's two main functions that brains serve. One is to predict and preserve. So the part of the brain that preserves or like to retain, what ends up happening is the dopamine production, since it's being produced artificially produced by putting in more stimulus, your brain naturally produces it a lot less. And then it starts to stay in that place. So what happens is the next time for me to have fun, I need something more stimulating, more and more and more. And a lot of times when people talk about addiction in our youth, we only talk about the substance abuse and drugs. But what we have to remember is it's really difficult to tell if someone's going to be addicted to alcohol or some drugs until they've tried it. Well, one of the two factors we know is one is genetics, which was in the quiz that you guys took. Number two is your exposure to certain conditions, right? So if you're constantly exposed to a situation where you need a high sense of stimulation, eventually your brain's response it adjusts, and what ends up happening is it requires a higher level of dopamine production, which is stimulating, and more dopamine production, and then natural brain production of dopamine drops. So today, for example, if I took my children to the movies, I don't know how excited they will be because we have this large TVs and the contents are all like, pretty intense. And so I guess the point I'm trying to get at is we already live in the day where the children's brain are not allowed to rest. Now, because of that, the culture around drugs has been a lot more intensified. So recently, the one that kills the most people is drugs called fentanyl, and all these other drugs. These are synthetic drugs that were created initially to help people struggling with um, cancer or with pain management and things like that. But again, the potency is so high that it's when we do a search, we put the gloves on nowadays because something like fentanyl could get on your hand and still get you high. So these are what the youth is facing today. Now, I'm not trying to paint a picture that's too grim, but I also would like to be realistic. Um, and some of these drugs, because they're synthetically made, a lot of times it's just a lot higher in potency. Same thing with marijuana. And people talk about, well, you used to smoke in the back in the days, and from like more secular general population, the potency is different. It's at least 2 to 3 times higher, whatever is being consumed today, which is something I would also go into later on today. because there's a lot of confusion about legalization and all that other stuff. But some of the things, because of that, here's the thing. Their brain is still, so if somebody is under 27, I believe, their brain is still developing, or 24. I'm sorry, I'm not really good with the statistics and numbers, but what ends up happening is that their prefrontal cortex, which is part of the brain that actually helps you make the right judgment, is still premature. And when you start to use substances early on, it inhibits growth of the brain. And it also wires the brain in a way where your distress tolerance, your discipline, your ability to wait for things, all these basic human disciplines that we require get all interrupted, because what happens is that way brain grows is that, so there's this old thing, how brain develops, of what fires together wires together. So what ends up happening is that a child's brain is growing, and depending on what they're exposed to sensory wise, it starts to have little sparks in your brain. And if the healthiest things they're exposed to the healthiest pattern, like, families, warmth, nice, environment, then they grow most ideal way. But if they get exposed to not so ideal environment, or like, let's say they're 13, they start smoking or marijuana, what ends up happening is called short circuiting. So normally, let's say they have a feeling, then it will go to my prefrontal cortex. Let's say I'm angry, and then I feel angry. Then you would usually, a thought will fire to my front prefrontal cortex, and then where the judgment is evaluated would tell me, that's probably not a good idea right now. I need you to settle down. Message gets sent back. I settle down and I'm behaved. When you use drugs, what ends up happening is that the drug actually intercepts that part of the brain, right? So what ends up happening is that it only starts to focus on the part of the brain that's overly emotional. And again, uh, I know as a Christian, I don't personally believe in evolution, but just for the sake of what is out there, more from a secular scientific view, there's a part of the brain that's called limbic system, and so from scientific community, um, according to evolution, what people say is there's a part of the brain called old brain. So if this is my brain, and let's say I'm facing this way, these are called the new brain, neocortex. So these are the brain that's more advanced, makes people social, and that's the one that gives us discipline, pretty much checks the old brain in check, which is around here. And this is what's called limbic system, where all our emotions are aligned. And what ends up happening is that if you use the substances, it kind of disconnects the two. So what happens is that you're just left with what's known as the old brain from scientific approach or ideas, old brain, which is pretty much just raw emotions. So with children, what ends up happening is their temperament and their mood stability, their behavioral functionality could be severely impacted. So one of the things we always talk about when a person comes in, when we're doing what's called biopsychosocial, is pretty much a assessment of the client that are coming in. We ask about onset of the use, because that's one of the profound factors. So you're gonna see low frustration tolerance, losing interest of things. They already do this as they grow as a child. All I'm saying is it happens at a lot rapid, like for example, when I was a child, when my dad said, "Hey, let's go like kick a ball," I would have been thrilled. You ask that to kids nowadays, they're probably not even going to, first of all, respond. I don't know if that's the case for all of you, but I think you get the point. Now, if you throw in kids being exposed to some of the mind altering drugs, they're going to be miserable, because it's like kids that are, let's say, who lived only on sugars. That they're not going to have a lot of experience that's going to be really wowing them in their taste bud. So it's kind of, that's the biggest impact that we have youth. And the other piece, because what happens in your brain is it severs the part of the brain that keeps you more social and high functioning. The biggest issue is they isolate. Now, this is what's most relevant to what we're going to talk about today, because God designs us to be social, the communion and church and connectedness. And what's really interesting about addiction is that it is a disease of isolation. When I go to other places and kind of do a presentation, I always talk about, if you want to grow addiction in a petri dish, just give it a hint of isolation. Because think about it, chemistry, biology wise, the reason why addiction is dangerous is because of the whole brain. It makes it an isolated brain. So when you consume certain or ingest or exposed to some kind of addicted, for example, I could ingest a marijuana. It targets the part of the brain that it it overstimulates the part of the brain that's overly just emotional, and not the one that makes me function at a higher level. If I every time right before, let's say I'm gambling, then right before I get a next hand, and that dopamine produces the same thing. So your brain is essentially being fragmented. Therefore, the person you are is also fragmented. In addition to that, way you behave and things you do is almost antisocial, or it's difficult for you to function in the society. That's why a lot of people where I work right now, I have different programs, but one of the biggest program is residential program, because their ability to function in the society has been severely compromised. And of course, big part of it is keeping them away from substances, so that they, for a given amount of time, until their pattern of behavior changes. But the biggest thing is, a lot of these people aren't able to function at the level of what's required in the society. So then what's internally isolating becomes externally and socially isolating. Now, what makes this worst is, this is, I know, one of the themes that comes up a lot, especially when it comes to helping out these families, is the shame. And it's really interesting, because you guys all know, I'm assuming all know, that's where our sin kind of, the first time God looks for us when we hid, that's out of shame because we're naked, right? It's kind of a similar thing going on there, where, shame is, and the stigma that's attached to addiction is huge. As I was talking about before, what's really funny is that out of all the mental health, addiction is the most uh, uh, um, judged or conceived to be like bad, or it's a bad moral decision. It's like, if somebody has diabetes, they're not going to really judge them and say, you're making a decision to have a high blood sugar. Yes, there might be some situation that led for the person to have, but what about people that have just a genetic diabetes, right? They didn't make it like that. So uh, although it's a significantly medically, biologically affected symptom, because of the way our culture and history built, it puts a lot of guilt and shame around it. And as a lot of times, unfortunately, it happens a lot in church too, because it's perceived in a certain way, which I personally believe that, although I work for a private institution, I personally believe there should be a lot more treatment centers or addiction treatment that are faith based, just because of what we know, right? God's grace. God, when we were in a shameful place, when we're still sinners, God didn't turn back on us and say, "Oh God, those people are very shameful, and let's just forget about it." Um, and it's kind of the similar thing. And the more connected we are to God, the less sins we experience. And to be completely honest, that's exactly what happens in addiction. Um, so kind of going back to the youth and the shame part, what happens in typical family is that they have no idea what to do. And because of the shames and guilt that's attached, they don't want to deal with it. So what's worse is, what ends up happening is, so then these children or the youth or the person who's suffering that needs connection, because that's what's going to, because they're fragmented, and it's like just before, it's just like how we are before we met our Christ. We're shattered into pieces, and we need to bring it together, right? And in order to do that, there needs to be some force or glue or something, which, and a lot of times what ends up happening is that these individuals actually get isolated, even in the family, because first of all, there's a lack of knowledge. And when there's a lack of knowledge, when there isn't wise counseling, people start to become afraid, fearful, and because of our sinful nature, we start to judge. And once we start to judge, those people become isolated and hard to understand, and they don't get the proper support they need. The worst part is this, is then they connect to the wrong people, especially for the youth. Before I became earlier in my career, I've worked in a program called um, multi-dimensional family therapy in Connecticut. So essentially, this is a program specifically designed by the state with the contract to help those individuals or the families that are struggling with at-risk youth being exposed to in the inner city. So I was working in New Haven, Hartford, where it's low socioeconomic class and like minorities. And but what's interesting is that there's a lot of programs that are like that. But as you know, there isn't really a manual for parenting. But one thing they do all agree throughout online, there's MDFT, there's MST, there's about 50 different programs that are supposed to help the inner city youth that are at risk. But one thing they all unify, they're all different, but one thing they all talk about is the strongest protective factor for these youth is their connection to their primary caregiver or a community or a church. It could be anything that is meaningful relationship to them. That's what's really going to keep those children safe. Just like anything else, addiction is not away from that. It's almost, the best way to look at it is like, and I use this analogy a lot, and I could be off, but bear with me. It's like gravitational force. There's Earth. Imagine I don't have gravitational force right now. What I'm going to do is float. If you float, what is the natural tendency you want to do? You want to ground. That's how humans are. Then what do? You look around and you see another thing that's floating. Now, this is where the enemy deceives us, or in addiction, what deceives you is that then you see something floating right next to you, hold on to it, thinking it's grounding you, which could be the target of addiction, right? It could be the substance or whatever. Let's say the children feel isolated, anxious, and they did a marijuana, and the first thing they may, for the first time, they feel really good, so they hold on to it. But what's really happening to you is you're floating together. It could be also connections, right? So if they're not grounded in the family or the church or God, rest is extension of that. What ends up happening is they got nothing to ground themselves on. So it's like a tug of war. And and in our treatment, one of the things that we are very different as an entity is that we know that very well, and we provide that. We call it's a tug of war. So the drug or the object of their addiction or substance of their choice is pulling right toward them, and we're pulling back with the relationship, the connection. Treatment is not connection. Treatment could be a pathway to connection, which I will get into later too. But the most important thing when it comes to youth use is who is going to ground them. It doesn't necessarily have to be the family. It needs to be left to the community, right? Especially church community. If we could keep the youth in connection with their families or however form. But the most important thing for you to get there is for you to have the proper education, number one, around what is that whoever is, once they are addicted, they're no longer in charge. It's called hijacking. Literally, their brain takes over. Now, degree or intensity of how addicted the person is how much of a hijacking has occurred, right? But with the potency of the drugs and things we have nowadays, it's pretty quick. Now, The other piece that I want you to talk to you guys about is when someone is addicted, how do you know if this is problematic or not? Number one thing that you need to understand about drug use or any kind of drug use is the proper usage, appropriate use. So I can't, if let's say somebody has an anxiety and then they're using some kind of medication to address that, and they're using it while going to counseling, while talking to a youth, uh, while talking to a counselor, and they're following the regimen, have the condition under control. I actually wouldn't say that's addiction or bad. That's fine. That's one of the interventions that's available for the conditions that people suffer from. It's like, again, if you have high blood pressure, you take a high blood pressure, um, medication. So it's the same thing. Um, Now, again, the shame and guilt sometimes, like let's say, I think the best way to disclose myself is that I have a severe ADHD. Apparently, I didn't take my medication until I was actually doing my PhD program. Now, am I addicted to ADHD medication? No, because first of all, the person who has the symptom taking the meds does not make them high. It actually addresses the issue, and it makes them like it brings them back to the ideal state the person wants to be. Now, would I have been um, uh, able to function without the medication? I probably could have because I've survived through, grad school, a master's degree, everything else. But through my master's degree, MFT, part of it was for you to go through your own counseling. I found out I had some uh, uh, learning disability along with ADHD. So then when I'm taking this med, there's even to this day, I still have a shame sometimes. Even now, you can see a little bit of holdback and say, "Oh, I need to make a confess." Like it's not a confession that I have to make. This is just like anything else. If we have a cold symptoms, we go and we take medication. But even with the cold medication, you take too much, then you could be potentially abusing, leading to addiction. So what we need to remember over and over when the shame comes and all this, no, it is a medical condition that affects our brain that leads to a dysfunction. So it's not a moral failing. So is there still a lot of shame that's attached to it? Yes. So if your child or loved ones in that, the first thing you have to do is not shame them, because with shame, addiction gets worse. Because what addiction essentially is isolation. Why? Because they hide. Oh, I feel horrible. I want to hide. I want to avoid. God says to Adam, where are you? Hide, because I'm shamed. So this problem of a stigma leading to shame in addiction is bad. And one thing I want to hold accountable for everyone, even with our clients, clinicians at my workplace, one of the things that I become really upset is when they stigmatize or label, and a lot of times a new clinician would do that. Oh, that person's just bipolar. That person's just borderline. Or that person is this and that, and that kind of talk doesn't help. We should never label. Oh, he's just an addict. We can't use that word too, because what we can do is provide a place for them to be not be shameful so that they could talk about the problem. If you want to talk about preventative measures, I don't know how many of you before, I don't know if you guys had an opportunity to talk about, talking about sex to youth, because where Pastor Alex and myself went to school, our director is also a sex therapist. And one of the things when we go into the class for that, we learn is, how do we talk to our children about sex? And one of the theme, bottom line is somebody's going to tell them, and it's probably better off it being somebody they really care and love for them, which a lot of times are parents or somebody they rely on. The same thing with the drugs. You need to have a discussion early on. You need to have discussion. So with my kids, I don't even have to talk about drugs yet. I have a 10-year-old and 6 years and 5-year-old. You know what I talk to them about? Phones or computers. And there's this video game called Roblox, and there's a whole bunch of other stuff. And I would told them, look, what's going to happen to you is that when you play too much, you're going to miss it too much, and then all you're going to think about is just the game or the cell phone. And I do basic training for them to understand the mechanism, right? Too much is not good. Teach them how to regulate, moderation better. But these are also like the wisdom that you go to church and you listen to sermons and things that kids that are in church are normally planted with, right? Um, but the bottom line is, you know, when it comes to youth and how it affects the family and how we're going to help our youth is to be preventative, which means that you need to start having conversations with them preemptively. Don't avoid it, because what ends up happening is that by the time you start to have the talk, that's when the problem is already there. And to be completely honest, we live in a day and age where you just look it up with the child, look it up with your, children, and have an education together. But the bottom line is that you need to do it together, and you need to be connected to your child. You need to be connected to your youth. You need to be connected to your congregation. I mean, at the end of the day, that's what Jesus wanted for us to be connected. As much as we're connected to God, it's the same thing. To me, drugs and all this addiction issue is it's the best vice that enemy could come with to dismantle us and come at us both as a community. I mean, this is a serious issue. I have a friend that works in an ER, and I work in a substance abuse clinic at a high level, and I've seen more death in my clients ever than the person who's working at an ER. So that says a lot. Um, So the last piece that I want to talk about a little bit more before we go into any questions is marijuana. Some people say it's a gateway drug. Some people say it's, good or bad legally. Bottom line is this: with any drugs, if you could avoid, better, because you don't know until you try if you're going to be addicted or not. Now, if marijuana has a specific use medically for people like pain management, chronic pain management for people that have a severe conditions, or cancer patients. And outside of that, personally, I mean, obviously, whether it's legal or not, there's many things that's legal that kids should be regulated. The problem is kids are not learning to self-regulate. People are not learning to self-regulate because we live in a big data technological society. The idea is more is better. So how do we raise an individual? How do we become an individual that's focused on saying no when there is more, right? So what's important about the piece about marijuana, if anybody comes to you and talk about, well, marijuana is okay, it's just them wanting to minimize whatever guilt they have going on. And it's between them if they're Christian and God, and it's between them and their conscience. But if you, as an expert, ask me, what do I think about marijuana? Is that, again, the appropriate use. If the doctors prescribed it for a specific reason and it's being regulated, that's fine. But it's the misuse and inappropriate use, right? It goes back to why we sinned. God gave us specific instructions to how to properly use things in Eden and how to go about it. Do everything but this. What's happening here is the same issue. I'm not saying doctors are gods, but there is a specific use, time, and place. We serve and live under God that's orderly. There's order to things. If they're using it for the proper, understandable reason, yes, CBD oils, if it's helping, there's a whole bunch of other stuff. But the issue is, what's deceptive is they make you focus on the wrong thing, like our enemies always do, missing the point. So if you want to have that discussion with your children, One of the things that comes up a lot is that we have some younger generation that are coming and saying, I just smoke weed here and there once in a while. What's the problem? What's the problem is that you're literally practicing your brain to be more susceptible to later things that you're training your brain to be more susceptible to be fragmented, meaning that you're just trying to, so it's like opposite of disciplining training. You become less patient, you become more um, forgetful, you become to have less frustration tolerance, and whatever you are doing using the drug to lower, when it's removed, you're going to be right back where you started or the worst. So let's say if you don't properly, if you're not using marijuana properly, but somehow some kid tried it and their anxiety is just gone. Yeah, wait until that's gone. So it's not giving you total independence. And that's why it's called substance dependence in the past, they used to call it. But bottom line is, if it's not properly used, it's the inappropriate use of things that's leading to the problem of any kind of addiction or anything like that. They don't have the regulation, and it's a biological issue. And what's great is that there's so many different ways to treat it. But again, what stops addiction, what makes addiction worse is not so much the treatment. It's the basic resources that humans need or quality that they needs to be exposed to that's not available. So let me give you an example. We started to work with the family because this is what we realize is that client starts to use substances. One of the most um, prevalent thing they do is they start to lie more. They don't spend time with the family. You got to remember this part of it. If you have anybody when they're doing that, you need to know their brain is hijacked, and that's not the best way to put it. More for, but for given the time and situation, there what ends up happening is like I saying, like for example, their brain is already very desensitized to stimulus because of whatever substance use or addictive behavior they're engaged in. So what used to be meaningful in the past fades. So there went, so for example, of an addict spending quality time with their daughter versus getting a hit or whatever that's making them, literally biologically to them it doesn't have the same effect. Spending time with daughter has no meaning by the time if they're deeply into using addiction, using and addiction. So it's important to have these understandings. And in our treatment, what ends up happening because of that, what ends up happening is the client adheres to be treated, but all the resources they need to be a human and all the connection that's the basic elements that's required for them to have a successful sobriety is gone. It's exhausted because first of all, people again they love them, but then also there was this window. So substance use disorder went through a lot of changes in its perception. So there was a point where tough love was supposed to help them to a degree, yeah, but a lot of times it doesn't. I guess the best way to say is like, okay, so with the coronavirus situation, I was one of the first people who was able to, thank the Lord, get the vaccine early on. So let's say, okay, so I got the vaccine. So then I remove my mask, I remove everything from me, and I'm just walking around just without any precautionary or support I get. Sooner or later, I'm going to get it and things are going to get bad. So that's what's happening a lot of times that people don't know if the problem is complicated. We need an intervention that's just as complex. But a lot of times, what we do in our human nature is minimize. Again, what's really interesting is that that very behavior is what people get addicted, right? So when I get overly anxious, instead of embracing all the complexity and endure the emotional pain and stress that's going on, let's say I'm able to pop a pill and make the pain go away. Again, your brain is designed from a scientific point is to preserve, predict and preserve. And whatever is simple and quickest, they're going to go for it. Unless you have you use and you're used to using your prefrontal cortex, or the part of the brain that's more complicated, to override that. So if you're in a vulnerable place, stressful place, I don't know if some of you heard about it, fight, flight, or freeze, right? And that's what's related to trauma, because when things go really bad, your brain, what it needs to do is bring down the options, right? Because if there's a dinosaur that's chasing on my tail, I can't be thinking about 5,000 different things or thinking about how beautiful the star is. What it does is that your brain automatically shuts down rest of the stuff and just give you three options, which is fight, flight, or freeze. So if you're in there that stressful situation, and let's say you just happen to have a little drink to de-stress you, then your need to actually address the issues are gone. So what you're going to end up doing is start to depend on that drink. And on top of that, you have a genetic predisposition. There you go. And you know what? A lot of times that's better than talking to someone. Comes isolation. Imagine you're a kid. You're going through a lot of hormonal changes, stressful in this day and age with COVID and everything. Wow, the marijuana, one hit, and I'm totally okay. It gives a quick fix for the moment with more consequence. So I guess with all that, the point I'm trying to drive back to, I think that's important for all of us to realize is if you don't want your child to get there, you can't do anything about it at this point. To be completely honest, we don't have control like on this situation. All we can do, because if you don't think like that, something were to happen, then you become too arrogant to think that somehow you are, this is where the guilt comes from. A lot of times family parents come in, it's like, I should have known better. I was like, man, this is a lot bigger than you. It's a society issue. It's a spiritual war. It's a whole lot other than you. What we can do is build the protective factors around this. And the biggest protective factor is the institution of family and the communion and the church and things as believers that we know, believe it or not. And of course, the treatment needs to be there. So, one of the things that we can do is have an open discussion. It could be a forum at a church. The more we speak to the children about this, the better it is. Because somebody is going to teach them if we don't. And if you learn it the wrong way, then it sticks with the wrong way. Number two, if somebody is struggling, we need to make sure we build a safe place. If person is not safe, they're not motivated. This is brain chemistry. So one of the things we always talk about in treatment is called therapeutic rapport. What it really literally entails is that for me to be able to provide a place you feel like you're safe, because otherwise, whatever I'm telling you is not getting through. Your brain shuts it down. You need to feel safe first. But with shame and guilt and all these other things, how do they feel safe? So where is our refuge? Like spiritually, church, spiritually God, yes, but church or the family. These are the places that people could feel safe. But what ends up happening when one of the it's just like how the devil or the enemy works against us, right? The evil spirits, they divide and conquer. So the first thing what happens with the child is that the family becomes disrupted and family is no longer a safe place. And it's the deception is for them to feel safe with the peers or the people that they're hanging out outside of church or the safe place because they're all doing the same thing. Because perceptually, if everyone's doing it, I feel like I'm normal. Every time I go to home, what happens between the gap? You feel more judged, you feel more, of an outcast. So it doesn't take a rocket science to treat substance abuse or things like that. You need warmth, kindness, empathy. So let me tell you about empathy. So biologically speaking, God built us so that when you feel something, I feel something. So there is something called mirror neuron. So what it pretty much does, I don't know, and also I don't know, some of you heard about it. It's called limbic resonance, which means my ability to feel what you feel. So your brain detects your facial expression. So it's like when a baby, they're being nursed, literally their body temperature synchronizes with mom's body temperature. God built us biologically to connect with each other, meaning that if I can't feel what they're feeling, it's really hard for you to relate, nor for the other person to really feel they're connected or safe in the environment. But then let's think about it. I have such a gap between your understanding of addiction my understanding of addiction, and we come and there's a problem, everyone's stressed, my ability to connect with my child or the loved ones, it's difficult because I can't deal with my own anxiety and problems that I'm seeing through this. So then the person feels further and further isolated, and they connect with what? The likes, right? Because they look like that guy, that dude's cool. He's just connecting. So then the brain firing goes, oh, okay, let's connect with them. And that's been the reality of our society today. So I know I said a lot really fast, but only three things you really have to remember when it comes to addiction. Number one is that it's a medical condition. It's a disorder. Number two, family connection or any kind of connection is much more important than any other treatment that's available. Of course, treatment is important. If somebody is having a withdrawal, they need to be detoxed. So knowing appropriate places to refer to, knowing those basic steps, these are all available in webs. In most of the treatment, they're in such a competition because there's so many clients, they're very well described. So that's something you could also speak and talk about. As a community, as a church, obviously prayer, but in more of an activity-based way is have the night where the community sits down with children and talk about this. So you intervene before they learn about this from all places, because it's just like a cheap salesman, right? Because and I say this all the time because sometimes I get accused of being a salesman because it's a huge finance producing industry. They're like, well, you're just here to sell me, sell me treatment. And I tell you, I said, the difference between a therapist and a salesman is therapist starts with the cost. Salesman starts with what you want to hear. So the point is, if you talk to your children, most likely our talk will revolve around the cost of what's going to happen to them, the reality. If they hear it from somebody from their, I don't know, like their peers or anybody else who's they're going to hear what's good about it. They're not going to tell you, well, your brain is going to stop developing and your judgment will be impaired and you'll have continuous mood. Nobody's going to talk about that. So it's important for us to be preemptive. And number three, the biggest thing that we could do as a community and church is not only increase our knowledge individually, but also make sure that the church is a safe place, just like anything else, because we live by grace. So we need to show the same grace, right? Just like any other sinners, right? Because if you really think about addiction from a biblical standpoint, it's an idol that works in a very physiologically strong way, right? But if just like any other sin, we give, I mean, God gave us an opportunity to repent, and by His grace, we're living and breathing, and we work to bring glory. And I think one of the biggest issue is that if church is judging addiction, that's a problem. Um, but if you when you break it down, we are the church. So if my child comes in, and then that enemy knocks in your heart and say, "Ooh, that's shameful. Ooh, don't tell your pastor. Oh, don't tell Alex about it. Oh, don't tell this and that. Keep it secret. Hide." It's the same devil that told Adam, "You're shamed. You're naked. Go away. Don't talk to God. Isolate." We can't do that. So I know I talked long, and wow, it's already 6:20. Alex, I would like to open up for questions or anything of that sort. Is that right timing or?
On mute. Okay. Can you all hear me now? I think I'm unmuted now. Okay, great. Yes, thank you, Sean. I think you've done a great job. Definitely, you've covered quite a lot. Thank you very much. So I think, yeah, we can stop, take some questions and comments, and then if there are anything else that you have to wrap up, then we can do that. So the floor is open for anyone who might have a question. You can unmute yourself and then ask directly. Or if you have a comment as well, you could go right ahead.
Hello, good afternoon, John. My name is Nofa. And thank you again
Hello.
for taking your time out tonight. We really appreciate it. We've learned a lot, like you said, in the time that you spoke. And it's a really big deal to try to understand addiction and the family dynamic however we can. So I guess my question to you is, would you suggest or would you say that there's a way to kind of help someone understand that they may have an addiction, although they may not see it that way? Like, for example, I guess to make this a bit personal, whatever. I have quite a handful of friends or a few friends who constantly use like weed. And every time I kind of like bring it up to them, like, yo, do you think you might be addicted to it? They're like, no, like I still function. Like it's not a big deal. It's just weed. And it's like you can literally get addicted to anything, you know? But sometimes people don't understand the severity of what their addiction looks like. So they make excuses for it. So I guess how would you say to bring attention to that if someone's having a lot of pushback?
Oh, that's I'm sorry. Oh, no. Give me 1 second. I'm sorry. So that's a very, very tough spot because there are two things I want to talk about. If as a fellow Christian and loved one, it's different. But from a professional view, if they're able to function, it's really difficult to have that discussion because everything, the diagnostics and everything is revolve around their ability to function. So best way to approach it is to talk about the risks and kind of amplifying that as much as you can, especially around, you know, the long-term effect of it, right? Because a lot of times people look at, okay, just a week later, 2 weeks later. One of the biggest thing with marijuana, each specific substances has a different manifestation, but marijuana has a specific implication research on having impact on heart diseases, memory loss, and the biggest thing is, again, the long-term effect is not really great. So it's almost like convincing somebody who smokes cigarette, saying, well, eventually you may get a cancer or the risk that you're being exposed to. um, but I think at that point, what's more important is do what you can do, and then making sure that you prepare to kind of help them when they're at that point. Because with substance use, the best thing you could do is catch it as soon as it happens. The the time between their moment of rock bottom, some people call it, or that moment of, oh my God, I need help, and how quickly the treatment happens is important. Now, what most of the people do is that they exhaust their energy inefficiently. So what happens is that by the time they actually need the help, you're tired of talking or you're done with them. So then when they actually need the help, people are all gone. So with your question, I would strongly suggest you to obviously continue to pray for the person, but also let them know, look, I'm here. And give them an opportunity. Let them know that you're non-judging and you're just going to be there when they really need help. And usually that works a lot better than you trying to actually reach out first.
Thank you.
Yeah. My question is the use of marijuana, of what significant is it for the brain? Because some people say the doctor prescribed it for me. What is the significance?
Significance really has to do with the potency, right? So it depends. We're talking about like an older adult with chronic brain disease, then the primary provider who's recommending it will rule between the benefits and the loss, right? But in case of youth, definitely not good, because again, we're talking about brain that's developing, that's being manipulated and to be stimulated specific regions of the brain. So if you're not 27 and you're smoking weed, you're going to have consequences. And a lot of them say, well, it helps me better understand. So this is funny because some people that go to college say marijuana brings my, anxiety down. So I use it. It helps me study. Every time they come up with that, I say, well, how does it help you retain things? They say No, it doesn't. So what ends up happening is that whatever marijuana does, it gives you temporary relief at the moment, makes you feel like you're doing better or performing better, or something's better. But one of the most significant issue with marijuana is memory. It totally destroys it. So they can't retain anything. And their performance drops when they're not on it. Go ahead.
Yeah, because my fear is, as you rightly said, it creates a fragmentation of the brain. So
Yes.
if this is if this is what happens, then of what use is it for doctors to be prescribing it for people to use? So I can see that contradiction. It makes no sense to me.
Well, it's like again, vaccination, right? COVID vaccine. There's a lot of you know negative side effects, and it's just the truth of the medication. But it's how and when it's used. So for some people, like for example, like people that are going through chemo or like some kind of severe pain, if they're under what is it cancer treatment, or you're going through cancer, it may be an option. If you have a severe PTSD that your everyday life is like hell and you need to find a way for you to be on some kind of a regimen with marijuana and treat your anxiety. But you see, again, there's so many other options, right, to treat that. So then we need to speak to the person about why marijuana. And there are times people are choosing to take that because of, from a medical perspective, that's what's most fitting to a person. Because nowadays they have something called PGT testing. So you go through a testing to find out genetically which chemical components fit you the best for your psychological needs. So there's a lot more complicated medical piece there. But even as a health providers, we don't perceive marijuana as the primary layer of some kind of a medical regimen.
Thank you.
I'm sorry, I don't know if I answered your question. I said a lot, but
Yeah, thank you.
The floor is still open for more questions. For anyone else who has a question?
I know that all the questions are based on marijuana tonight, but that's what came to my mind first when I had a question. Because in our culture where we came from, where we come from, we have a set of people that are called Rastafarians, and for years a lot of them have used marijuana for, in their practices of worship and doing further stuff for healing, because they claim it's good for the brain, help them to think more clearly. And a lot of professionals in the island, they smoke marijuana now and again because it's a help them stay focused. So I want to see what your take is on the subject of, because right now I know people who I'm still connected to, who have been smoking from they were young until now, and still there's no adverse effect. I don't know if there's going to be any later on, but they're in their 50s and some 60s, and there's no adverse effect. So what's your take on that?
So you got to remember, any kind of scientific facts that we have is based on the lab, not on the individuals that we have. So which means that yes, people would have a different response. So a lot of things that are shown in the science is for the general population. So there's always an exception. But there's a couple of things I want to point out to people that may claim that I don't have any adverse effect. You got to remember, if somebody uses marijuana from the earlier on, their baseline is, they don't know the baseline. So then you're comparing something about, let's say I didn't have adverse effect, but they don't know how they would have been without it, especially if they started early on. So it's really hard to say that. We could probably say I could still function and I don't have any, negative effects from it. That's fine, especially when it comes to cultural piece of it. It's not, but this is where I want to go to, that it's not so much about whether it's right or wrong. It's more about, is it is it factually helpful or not? And one thing I could tell you though is that those sciences behind the fact that if you do use marijuana early on, it is going to affect your mood and your growing pattern is factually driven. Now, how does that affect a person and then ramifications of that is a whole nother story, because there are people, for example, when they're drinking, right? And they drink to moderation and they're fine. It's not a huge issue. Then I can't really speak to that. But again, a lot of times it's the risk that's involved, because somebody could be fine at a point and then at a given point, it's not like when you see a negative effect, it doesn't gradually go like this a lot of times. In reality, what happens is that it goes like this and a point it skyrockets, right? And then it hits with all the other complications together at the same time. So I think we're talking more about the risks that are involved and the choices we have to make case by case.
Okay, thank you very much. Anybody else have any more questions? I guess maybe before the next question come up, part of what I'm hearing Sean talk about, especially on the subject of marijuana, when we come from societies or communities that are disposed or they are more acceptable to using it. Just like you said, those are basic influences. You know, environment is one of the main factors. So if one comes from a community or an environment where people don't raise an eyebrow about using marijuana, they will use. And the other thing I think is important to emphasize based on what is said and what we know, you know, about this subject is that if somebody started using marijuana early, and now maybe they're in their 50s or in their 60s, is not to say that it did not affect them. Maybe the effect is not showing now, that's number one, but number two, more specifically, is this. The level at which that person is functioning now, that person could have been functioning at a much higher or better level if they did not use. So the fact that they're not out of order now is not to say that there is a benefit to it that has lasted or that is an excuse to continue to use. And I think the other thing, of course, is that if somebody has been using marijuana or alcohol or whatever, you know, for the past 40 years, that's a clear sign of dependence. I mean, that's a very clear sign. So why will you be on marijuana or be smoking marijuana or drinking alcohol for that long?
So one of the things, Alex, I don't mean to interrupt you, but that's a good point. One of the tell is that when you take it back, can you live without it?
Exactly, that's what I'm saying here.
Yeah, so that would make a huge, if you start to have a withdrawal and you start to see symptoms, then you're at minimal dependent, yes.
Because if somebody is not able to function with it, and that's why they, I mean, without it, and that's why they have stayed on it, that's a sign right there that it is a problem.
Oh,
Yeah,
Absolutely.
just a question as well too. Just granted, if the marijuana. Let me ask you this: does the because I know there's different like types of marijuana, right? Doesn't that take effect to the individual as well too? Because granted, if you think about, you know, like one person said, like the culture, right? Isn't marijuana essentially is a herb, you know, the form of herb, and they use it for like healing purposes and stuff. So it's more of the natural based herb. But when you use it, I feel like when people use it for medicinal purposes or even leisurely, it's sort of like mixed, right? And this doesn't that play a huge factor, it being mixed or not really?
Yes. So when it comes to drug, there are a couple of things you need to think about is how it's administered and the potency of the drug, because that has different ramification. But the whole dopamine, the reward circuitry thing is one system that's involved no matter what. So for example, depending on what kind of chemical you ingest, you know, you guys probably heard about uppers and downers. Some meds you take, it brings you up. Some meds you take, it brings you down, right? Anti-anxiety medication are the ones that normally brings you down. One of that, and marijuana is identified more of a downer, but sometimes uppers too, depending on alcohol too. Those are not as profoundly affecting, especially when we're talking about younger, like children with like, you know, youth with younger age. It's more of the reverse circuitry that's a problem, because no matter what drug it is, or no matter what behavior, rewarding behavior it is, it involves that overstimulation of the circuitry. So it does, yes, depending on the type, the severity, or could be a little bit different, but overall, whenever you ingest something that is not produced in your own body, that comes from outside, it affects that. It overly stimulates that brain, so it does have a ramification on who you are, regardless. And the
Yeah, go ahead.
the
Okay, let me
other
take
piece,
this
okay.
question. You mentioned, you said that the brain helps in two things. You said to preserve and to
Predict.
predict. Please, can you explain that again?
I could. It's just, again, this is just scientifically. So what scientific community believes in is that our brain essentially developed from, you know, like the evolution, right? So how they dissected their brain is the oldest part of the brain is called reptilian brain. It only functions around survival. So everything is so when you look at my hand right here, if this is the spine, is that this region right here. And then they started to the reptiles started to realize, okay, well, if we continue just to focus on survival of our own, it's not helping us survive as a species. So hypothetically, what they did is they start to develop feelings so they could protect their offsprings. So comes mammals, where there's breastfeeding and there's empathy and their feelings. And that developed a limbic system where there is emotions involved now. So this part of the brain is purely so these two parts of the brain are the parts of the brain that only responses to preserving, seeing what's going on because it's for the survival, and then calculate what's going to happen. So what they're saying is that the difference between animal brain and human brain is that we have what's called neocortex on the top that actually goes further out and do all these other things. But when push comes to shove, all they're going to, when it's the essential part of the brain is to preserve and predict, because it's directly correlated with the survival.
Okay.
So three parts of the brain: the main part of the brain that only thinks about the survival, and then there's a limbic system, which is involved with the emotion and the motivation, again, is only interested in self-preservation. Then comes the whole neocortical brain. That's what humans, from a scientific perspective, is what humans makes human, which a lot of times gets cut off if you're in a situation, in bad situation. I don't know if I described that too well. I'm sorry.
It's okay. I got it. Thank you.
All right.
I have another question. I want to know the chemical drugs or the marijuana, which have more damaging effects on the brain?
So, okay, so marijuana, the chemical is not the issue. So I don't know how to put it this way. The best way to explain the whole marijuana thing is this way. When let's say I have anxiety and I take a pill, essentially what it does, or take marijuana, is that what it does is it balances the chemicals so that my mood is stabilized. Because when I'm feeling anxious, that's a chemical reaction based on what happens in my brain. But if I were to just take medication and not do a counseling, what ends up happening is it localizes the firing, right? Because again, the limbic system is being stimulated through me smoking marijuana or doing whatever. So in the long term, what happens is, although I could stabilize myself with a chemical of my choice, but my internal ability to address my anxiety gets lower and lower and lower. So that's the issue with a lot of people with prescribed medication or marijuana with a long-term use. The reason why it becomes problematic. Oh,
Can you please mute yourself, please, so that we can reduce the distraction? Thank you. Go ahead. Sean.
yeah. So that's again, that's why when Alex mentioned about when you take away, that's where you see the problem is. That's the point. So with marijuana too, you'll see most of the damage being done when you don't have access to the marijuana. Then you start to build symptoms around it, which is an indication of withdrawal or other side effects, and that's kind of the cornerstone of when it's problematic. And also, a lot of times marijuana should be left to the person's discretion. I know this is a very generic approach to this, but a lot of times if you have to ask a question, then there's a problem. Like, for example, like if I take diabetic medication on a regular basis, that's less likely I'll have doubts about it. But it's good to encourage the person to think that way. Let's say I don't know, somebody, even if it's culturally okay, there's no problem. And person comes to you, reach out for some kind of talk and saying, I don't know about this marijuana thing. And that person's using, that in itself is an indication there may be a problem. Because you wouldn't have a doubt or thoughts around it if there wasn't. So a lot of times when you do a therapy or treatment, that's where you start, right? Because a lot of times people come in and they say, well, people say I have a problem with marijuana. I really don't think so. I'm not sure. Then the question goes to, okay, if you're not sure, maybe there's something we could talk about, right? Why would you have the question, right? I don't go home and start questioning myself. Why is my name Sean? That's not a question I ask. But if it's something that is usually I have to ask question about, is something that there is something I believe something to doubt that I need to address.
I have a question.
Sure.
Okay, but thank you for coming, Sean King. I've been listening to you, and based upon what you're saying, from what I gathered, the importance of treatment, I gather the information in terms of how the brain functions. I have been serving in the street ministry where we feed a lot of dependent people in the city here. And many of them are not, from what I do know, the little that I do know, is not exposed to in terms of treatment. They're basically street. They're on the street. Yeah. So, and when you look at the age group, these people, they're in their 50s probably or so. And without treatment and without God, are we saying in this society that we're going to be looking at people in their 90s, if they live that long, dependent on chemical to function?
Can you come again with the last piece about the question?
I said, if those people are many people who are not exposed to treatment in terms of counseling and therapy and all that stuff, living on the street, if they do live, which many do pass early, they're going to be having a lifetime of dependency, just like that.
Yeah, most likely. Now, here's where connection is important, though. Luckily, now I don't want to say what I'm telling you right now is in place of treatment. Treatment is always a better option.
Uh,
But one of the things is, let me give you an example. Let's say I have a grandmother that's at a home, okay? I visit her. There's no medication they're going to put her on that's going to make her feel better
mhm.
and then revive that brain. But for some crazy reason, I come to her and I tell her, well, grandma, I wish you died. I don't really like you. Oh, God, I can't even say it hypothetically, but there's no drug that's going to bring her down quicker than that.
Right.
Meaning that those people may still do much better if there is opportunities for them to connect with somebody than nothing. So the idea is, and another issue with substance abuse treatment is that the compliance level is lower than any other treatment it requires. And compared to a lot of other mental health conditions, like you were saying, it's horrible. So there will be opportunities, but most likely it won't be strong enough to bring them back to the functionality they have to be in. So yeah,
Mm.
unfortunately, that's how they're going to be left. But that's why it's important as a society to not to isolate them and take opportunities to connect with them as much as possible.
So my belief of thinking that you get mellow when you get older that's false.
Yeah, I mean, yeah, it's when effects are different when you're older. Yes, I think that's as best as I could go. It's yeah.
Thank you.
No problem.
Okay. Any more questions or comments before we wind down for tonight? A number of people online. So I'm giving the opportunity again. Are there any more questions, any more comments? Have we learned something tonight? Can anybody, if it's not a question, or you learned something specific, maybe can I have one or two people just say what they learned? Maybe something that you learned in this session today that you didn't know before when we started. Anybody want to tell us briefly?
I've learned the earlier you get involved or start with the person who's struggling, the chances of recovery is very higher. That's one of my takeaway, and which this I can apply to ministry. They're not my family, but I do know I could extend warmth. I do know I could extend kindness, and I do know that I could show empathy. That's my takeaway.
Beautiful, beautiful. Thank you. Anyone else learned something or you were reminded of something as Sean did his presentation tonight that you said take away?
Yes, I like the way he said how to know that a person is addicted. He gave us 3 facts. One is we should not isolate. I mean, the person is already prone to isolation. You know that because of what is working in his brain is already fragmented, so he's ashamed of himself. He wants to isolate away. And we shouldn't allow that to happen as a church community. You know, we should find a way to provide safety, that is a safe environment with which he can open up, discuss, and seek help to what is going on with him. And another fact is that we should start discussing this mental health conversation with our congregation, with our people, with our children. The earlier we start, the better, so that they will be able to know the pros and cons of what is this? I mean, what it's all about. So thank you very much.
Okay.
Very
Thank you
informational.
very much. Yes, thank you. That's a good takeaway. Again, if you have any questions that are not maybe not coming out now, you definitely can reach out. If you're a member of the church, you know, we'll continue this conversation tomorrow in a different way, or you know, but we will continue the conversation, and definitely, like Sean encouraged us, and like my wife just said, this is a conversation we should continue until we all become more comfortable discussing it. Because I think one of the major challenges that we all have is that even if we have somebody in our families that is suffering with addiction or a substance abuse, we don't want to talk about it because, you know, we first of all blame ourselves and then blame the person. And so sharing the blame does not help solve the problem. And the church is not helping in the way we've been handling it before. And that is part of why I believe the Spirit of God is leading us to discuss this now, early in the year. You know, I said to Sean in the beginning that we definitely will need him back again. I'm hoping that in the warmer months, you know, when, you know, we can get together physically, this is something that we should want to discuss again. And those of us who attended now, I guess it will prepare us, you know, for further discussion. You know, it means, you know, coming to have a round table, you know, where we can talk a little more and be more practical. I think it's something that we need to keep doing, especially those of us who are in the communities. And I think most of us are, either where we live or where we work, you know, we have these issues around us, or we know people who are dealing with these issues that might not come to church and tell us. But if we're equipped, then we might be able to go to them one-on-one, you know, and share and encourage and point them in the right direction.
Sorry, there was a question online.
Oh, there was?
Yeah, on Facebook that I missed. The question stated before we leave, how does secondhand marijuana smoke affect others? If you could just answer that quickly.
Oh, okay.
I I think the health hazard, just like you know, smoking a cigarette, they remain similar. As far as getting high, I highly doubt that's what would happen. But again, it depends on the potency and the room, and so it's not highly desirable for you to be in that situation. Now, if it's younger kid, regardless, if you're in a situation where you have a secondhand smoking marijuana, it's probably not the best idea. It would have probably more contextual effect on the person than the biological. I think that's the best I could answer. I'm sorry, I feel pretty limited on that one. But that's a great question.
I see you are your contextual thinking, right?
I know that people with asthma, that can be a trigger.
Yeah, for sure, for sure. The medical ramifications are, I don't think it would be any different from secondhand smoking. But as far as from addiction perspective, if person has a history of using, the person has already relapsed. If you have somebody that's using near you, I mean, usually that's kind of the rule of thumb. But if it was just another average adult outside of the secondhand smoking health ramification, I don't know about the actual addiction piece.
Okay. So I think the general rule of thumb is that as best as you can, stay away even from the secondhand use or secondhand impact of, you know, either cigarette or any drug. I think that's the best advice. That's part of what I'm hearing you say.
Well, to be honest, if I could get everyone to not to try any addiction that could have a mind-altering effect, don't, because we don't know until the problem occurs. It's one of those situations we really can't predict. But again, you know, that's a lot more complication to that. But bottom line, yes, if you could not be exposed to the situation, don't be, especially if you're younger and if it's your youth. I wouldn't advise them being exposed to it.
Thank you very much. Yeah, is there any other question on the chat, for example?
No, there were,
No.
yeah,
Right?
we answered it and they said thanks.
Okay.
Yep,
Okay.
that was it.
Okay, that's
And also, Alex, before I go, the other piece is also kids being exposed to marijuana use. Let's say I am okay with using marijuana, and then I have a child. I'm just imagining this.
okay.
I can't just think about ramification of the chemical stuff, but it's also the idea of me relying on something outside of myself to alter things inside of me. It's probably not an ideal situation for the child because, again, their perception also counts into how vulnerable they are to yielding into peer pressure and other situations where they could be tempted. So I just want to put that out there.
Okay.
Please, what is dopamine?
Huh?
Dopamine, what is that?
Dopamine? It's
Yeah.
a chemical that's produced in your brain that it's called reward circuitry. So when you do something that betters your chance of survival or pleasurable, then it's produced to leave an imprint. So there's a euphoria that's created that's triggered by dopamine to make you repeat the behavior.
Okay.
So
like
then,
a stimulant?
right. Right. So when you use cocaine or any kind of, then the dopamine is produced to further reinforce the same behavior.
Okay.
But that any kind of outside of illicit drugs is directly impacted to that because then you're messing with the system that's adjusting. That's why people build tolerance because the first time you use cocaine, second time you use cocaine, third time you use cocaine, every time you need to up it to make
Okay.
sure to bring that system back up. Because when you are produced from outside your brain, it's called atrophy, right? It produces less. So same thing with alcohol, a lot of these things, it's not the actual chemical that's making you high or all this, it's the actual response chemicals from your body that's actually making you feel high and all these other things.
Okay. Sorry, thank you.
No problem.
Okay. We don't want to keep Sean on. He has his young chick. All right. But again, we are very grateful for today's presentation. We thank God for you. And I thank all of you who have taken the time to be online tonight. We will continue to answer questions both on this and on bad behaviors or habits that could impair family progress. We'll be discussing that tomorrow. Before we pray, let me just add, as far as church service in the building is concerned tomorrow, I don't have a full update yet. I'm going to be speaking with Sister Mark to see where things are. So just check your the chat this evening for us to know how that is going to go, whether we're going to be in the building or we'll be online. But either way, we're going to have service at 11. All right. Let us pray. Let us pray. Father, in the name of Jesus, we thank you for Sean. We thank you for bringing him. Thank you for the knowledge that you gave him. And thank you for the different levels of presentation that is done. I thank you for everyone that is online. I thank you for that which you have gathered today. And I just pray that you will help this knowledge to be beneficial to us and to all those who might be in need, either immediately or somewhere down the road that you bring us in contact with. We pray for Sean, we pray for his family, we pray for his profession. We pray that your mighty hand will continue to rest upon him and continue to move him in the direction that you have ordained for him. Even as he continues with his PhD program, that you grant him wisdom and speed, that he will complete it to the glory and the excellence of your mighty name. Thank you for every one of us. I just pray for our families, and I pray especially for those who might have family members who are, struggling with any form of addiction. We pray today that your mighty hand the hand of deliverance. The same hand that is able to deliver us from sin is able to deliver us from every form of addiction. Therefore, I ask for your supernatural intervention in every family, to the glory and the excellence of your mighty name. Lord, we give you praise, oh God, for the rest of the evening. We pray that you continue to guide and guide us. We give you thanks and give you praise. In Jesus' mighty name, we pray with thanksgiving. Amen.
Amen.